Hi, my name is Tawfik. I'm an interventional cardiologist and I specialize in endovascular medicine and vein care. I wanted to be a doctor because my sister suffered a catastrophic event when I was in middle school. She had a brain bleed and the doctors really saved her life, and that's what kind of intrigued me to get into medicine. I think I wanted to do neurosurgery, which is what the specialty that saved her life essentially. But as I went through the different specialties in medicine, cardiology intrigued me a lot more. I went to undergrad at Rutgers in New Brunswick, and I went to medical school at Temple University in Philadelphia. And then I did my interventional training back at Robert Wood Johnson in New Brunswick, as well as Thomas Jefferson in Philadelphia. I'm actually born and raised in Egypt. I moved to America when I was 15. Where I come from, getting into medicine is extremely difficult. Not that it's easy in America, but it's very difficult to get into medicine. And so when you have an opportunity like that, especially in America, you do all that you can to try to hold on to it and excel at it. A lot of the patients that come either through cardiology or through endovascular medicine, a lot of those relationships are long-lasting because a lot of those conditions are chronic conditions. So it's not that somebody comes and needs surgery and gets an operation and then is cured. Unfortunately, with heart disease and vascular medicine, it's a lifelong ailment or disease, and we work with the patients really forming very strong relationships to modify the risk factors and making sure that they stay healthier longer. So it's a very long, a lot of times it's a lifelong journey. A lot of my free time I spend in church. I'm the son of a priest, so I grew up in a church. Most of my extracurricular activities outside of work and school involved being in a church. We actually are committed to doing mission work at least once a year, and we travel the world, really in most continents, Africa, South America, even mission work in the US that does surgical procedures and medical management for patients who are in need. So a lot of the missions that I've done myself were back home in Egypt, where we provide free care, including surgical care. For my specialty, it's cardiac catheterizations, stents, but also medical management for patients. My goal at Premier Vein and Vascular is to understand my patients' complaints, get a comprehensive medical history, and an ultrasound examination that would allow me to customize a treatment plan that is tailored for each patient's needs.